Hello, everyone. Today we are reviewing a recent interview with a respiratory therapist by the name Pat Gonzalez, who provides a raw, honest look into the life of a modern healthcare and its workers. Pat does not just view her role as a series of tasks, but as a calling rooted in deep empathy. Based off her responses to my questions, I see a professional who balances the high stress environment of a hospital with a mature, patient first outlook. When asked about the most difficult aspects of her job, you can see Pat's vulnerability shine through. She claims her least favorite part of the job isn't the long hours or the physical labor. It is the emotional weight of being unable to save a patient who is just too sick to treat. She also talks of heartbreaking coding events where medical intervention just wasn't enough. I believe for a healthcare worker to admit that these moments are truly heartbreaking, it isn't a sign of weakness, but rather a sign of a professional who has managed to maintain their humanity in a system that often demands detachment. An important part of this interview focuses on interpersonal dynamics. How does Pat handle frustrated family members? Pat's response to this question was that she reminds herself that for the family, this might be one of the worst days of their lives. A big part of this job is knowing how to talk to people when things are falling apart. When family members are frustrated or upset, Pat doesn't take it personally. Instead, she stops and reminds herself of this. That perspective changes everything. She also talks about how to survive a shift when the ward is understaffed and chaotic. Her strategy is simple, and that's to prioritize and to help out where needed. She says, do the most important stuff first, then jump into help coworkers wherever possible. Pat says she can only succeed if the whole team succeeds. She knows it's not just about being a good worker, but rather about having the team mindset to keep the entire unit running smoothly. One of the most impressive things about Pat is her humility. She understands that in healthcare, technology is always changing. Pat is a lifelong learner. She is someone who isn't just satisfied with what she knows now, but is actually excited to grow alongside the industry, which she has shown by retaking every class until she gets an A while she was in college. But when it comes to success, Pat doesn't just care about the numbers or a paycheck. For her, success is personal. She stated, as long as I am doing everything I can for my patients, I am successful. Pat's path was not always direct, but once she started respiratory therapy, she says she found her calling. She has a good mix of high-level technical skills and deep emotional maturity. She also understands that a hospital requires as much compassion as it does knowledge itself. Pat does not just treat lungs, she also treats people. She shows a clear understanding of the beauty and the difficulty of this work. I believe she will continue to be successful and will be able to build lasting relationships with her patients. That is all for the analysis of the interview I did with Pat. I look forward to watching everyone else's presentations. Thank you. Bye.